Why were bottle-fed babies excluded from the colic study?
I answer. We choose to exclude bottle baby because there is in the market of Italy many kind of milk formula. So some subjects receive a normal formula, some subjects receive a partially hydrolyzed one. So it could be a bias, and so we choose for this reason. As concerns dosage, we have administered lactobacillus reactive at 5 drops per day in the morning. Okay.
All of the probiotic supplements seem to be isolated to 1 or 2 different strains. Ultimately, is that going to be sufficient? And are we going to be giving them these supplements that are more diverse?
That's one of the things. I mean, what happened now, I think we had to go by steps. And many of the studies that proved to be that probiotics were effective, they have a combination of bifidobacterium and lactobacillus. And so the thing is, at this point, it's like the same. I just compare it with the use of antibiotics. So there is things that you treat with 1 antibiotics, but there is things that you combining 2 antibiotics, you have a better effect. So I think there are steps to follow, and the first step is first to identify what one probiotic, one bacteria can do, and then maybe we can play with the combination of them.
I did want to make a comment with regard to the earlier question with regards to this whole concept of diversity and how, why one bacterium can do something like that, are 2 better than 1, and so on and so forth. And the bottom line is we don't have an answer to that. We can't say that today. But I do think it is important for many people to just at least conceptualize. It's really been just the last 100 years that we've made a drastic environmental change from the point of view of sanitizing both the environment as well as pasteurizing almost everything we eat. And if you think about the fact that, and we're talking about oral ingestion of bacteria, and that's a very different concept than just having different bacteria in the colon, which is, of course, a reflection of the kinds of things that we see as a result of how we're born, what we eat. But if for most gastroenterologists here, today, if you do a duodenal aspirate and an endoscopy and get 10 to the 6 colony-forming units of bacteria, you say that's overgrowth. And that's what you get in a cup of yogurt. It's like you're inducing overgrowth on a regular basis. Well, obviously, that's probably what was happening before we pasteurized and sterilized everything. And it doesn't take a lot of bacteria that have or may have an effect from a point of view of modulating immune response or inflammatory marker response in the gut, especially in modern society where our small bowel is completely deprived of bacteria compared to what it was, just decades ago.
Besides yogurt, would you review what other foods contain some of the probiotics you discussed this evening?
Sorry? Foods containing probiotics.
Okay. Well, now it's important to remember when we are talking about lactobacilli has nothing to do with milk or dairy products. Lactobacilli are producing lactic acid during their metabolism. So the lactobacilli are present on fresh vegetables, meats, anything that's fermenting is. And we clearly have a reduction of our exposure to this family with modern diets. We have no indication from these ecological comparisons across different countries that there are any particular strain. The major bottom line that comes all the way through is the poorer diversity. There are as many bacteria in allergic as in non-allergic, or in Estonia as versus Scandinavia. The difference is that the diversity, the number of strains is smaller in allergic individuals as compared to healthy. And this is which makes it so complex.
One comment with regards to the products and the commercial products. We're not going to go through a list of brands which would not be very long. We're really talking about very few. It's a handful of strains that have actually been shown to have the kinds of benefits that we're talking about. And it is a question of looking for products which have that particular genus, that particular strain, for whatever it is the specific benefit that we're looking for. And the last comment there, I think, from the point of view of products, because that's also a very important takeaway from point of view of what we recommend to our patients. We cannot say today that just saying go get yogurt is good enough. We can't. We know there will be, depending on what kind of fermented milk, fermented product, drinkable yogurt, etc. you're getting it, you will or may not get specific amounts depending on what particular regulation that yogurt is following. Their industry self-regulates it. If you look for that little seal that says live active, you know that you're going to be getting more than 10 to the 6th coliforming units, but you're not necessarily of a strain that is a probiotic strain. So just yogurt will expose you to bacteria, not necessarily to the kinds of specific strains we're talking about. And supplements is a whole different story than food, and this is another very important distinction, because food will have regulation with regards to what it contains, and supplements, unfortunately, and we're talking about the United States, very few, not many, of the supplements truly have or are made by responsible companies which follow a very specific quality control that tells you, and you know and can be guaranteed that you're getting that strain in that amount in that supplement.
My father, blessed be his memory, used to say that if two persons keep agreeing, one of them is redundant. And Beppe and I don't quite agree on this. And to be honest, I don't know who is right. But there are a few points I would like to point out. Probiotics are not associated with yogurts unless you put them there. It's important to remember that, as I said, lactobacilli are not part of dairy products normally. They are products, as I said, of fermented vegetables and fresh vegetables and meats. And I also don't want to be misunderstood, because I think the probiotics, when we agree on a handful of strains that are documented, this is a question of safety and giving to the patients. Nobody would take the responsibility of taking any fermented vegetable and give it to babies and say that it may contain probiotics. So we totally agree on that. The difference in our opinion, and whoever is right, I don't know, but the difference in our opinion is that I am suggesting that there may be in that fermented food that's part of the traditional fare in any culture, there may be many bacteria that would meet the probiotic criteria and have an ecological impact, which I indicated. But we obviously cannot recommend them, because if we are going to give it to patients or to children, then we really have to have the safety aspects. And this is where Beppe and I agree that we have to limit this discussion to those few that have documented medical effects, but also documented safety.